translational changes and to synthesis, manufacturing of proteins that are this process. So proteostatic dysfunction, again, our immune system recognizes these glycosylated proteins as foreign, starts attacking them.
Hi everybody, and welcome to the Kidney Coach YouTube channel. I am naturopathic practitioner Fiona Chin, co-founder of the Kidney Coach, Kidney Disease Solution, and Kaigenesis, which are our products. And I am joined today again by a very distinguished doctor, and that is Dr. Alex Grinberg. Alex, thank you again for joining us. So Dr. Grinberg is a very distinguished medical professional. He started his medical training when he was 16. So I call him a bit of a savant back in Moscow, and he completed 3 years of his PhD program in clinical immunology. He's got over 3 decades of experience in medicine. And I think what I really appreciate about Dr. Grinberg's knowledge is that he has got all of this amazing knowledge when it comes to the latest technologies coming out, biotech, and their advances in medicine, and then how to stack that along with things like longevity, peptide medicine, to really add to what Western medicine can offer us, and then really take that to the next level by really staying on the cutting edge. So he works in clinical practice, he works with patients. I'm sending him my very complicated cancer patients all the time because he's got such a good amount of knowledge around that, and all the, like I say, the latest technology that's coming out. So Dr. Grinberg, thank you again for joining us. I always appreciate your time, knowledge, and expertise. Is there anything else you wanted to add to that? I know you are really on the cutting edge. So let's move across to proteostatic dysfunction before we come down to my favorite topic, chronic inflammation and stem cell exhaustion. They're a bit more straightforward, but what is proteostatic dysfunction and how does that relate to everything else in kidney disease?
So proteostatic comes from 2 words, proteins and stasis. So everyone probably knows homeostasis is a maintenance of a stability in the functions, structure and chemistry and physics, everything inside our bodies. And for health, for normal functioning, body has a lot of mechanisms to maintain homeostasis, like maintaining similar level of oxygen or similar pH of blood and other functions that's related to homeostasis. So proteostatics means maintaining the same status of proteins. As I previously mentioned, all disturbances of DNA, telomeres, they eventually lead to translational changes and to synthesis, manufacturing of proteins that are pathological. So we have to maintain the production of proteins that are coded in our DNA without any without deviating from this process. So proteostatic dysfunction, again, it happens for different reasons. It can be post-translational, it can be DNA mutation, but also more simple things like molecules of carbohydrates. They like to join protein molecules to glycosylate them, the process of glycosylation. And this is not a good friendship because frequently our immune system recognizes these glycosylated proteins as foreign, starts attacking them. And you can guess that it at least increases the risk of autoimmune diseases, but actually it creates mild autoimmune process. And now medical science considers more than 100 previously considered different from autoimmune diseases. Now they consider them as diseases having autoimmune origination, even hypertension, atherosclerosis, and some other conditions that you wouldn't think are related to autoimmunity. So, and that this assault on protein molecules, either from carbohydrate, from virus, from excessive UV radiation or from medication or from toxins, they all change the original appearance of protein molecule. I'm saying appearance because that's what's really important. That's how this molecule appears to immune cells, and they start recognizing it differently. And this leads to many cascades of different things, starting from inflammation or autoimmunity, but also to senescence and eventually apoptosis. Because anything that joined the receptors on the surface of the cell, and usually this receptors on the surfaces of the cells are made of proteins. Modifying in the undesirable way these receptors lead to many undesirable conditions. And of course, again, very broadly known process is how the glycosylation in diabetes affects everything from endothelium causing the peripheral vasculopathy and changes in first in various in the capillaries, and then how it affects retina of the eye, how it affects, of course, kidney, and but that all stems from changes in proteostatic maintenance and proteostatic dysfunction.
Thank you for your expertise. If anyone wants to contact Dr. Grinberg and work with him one-on-one, whether it be kidney disease, especially integrating peptide medicine into your regime. I know I've used him personally for that. I'll put Dr. Grinberg's details below. He works out of San Francisco and is available to do telehealth and Skype consults with people all around the country. So, and as well in different countries because he's working with some of my cancer patients. So again, Dr. Grinberg, thank you so much for your knowledge and expertise. It is always a privilege and an honor to have someone as esteemed as you on our channel sharing your wealth of information. If you want to know more about what we do, head to www.kidneycoach.com. You'll find us on Instagram and Facebook under the same name. Remember to hit subscribe and like it. That way you will be notified anytime we put up new videos. And if there's any topic that you want Dr. Grinberg to talk about, or if you have any questions about this podcast, please put them in the notes below and we will be sure to answer them. Thanks again for being part of our community. Dr. Grinberg, thank you again for your time, and I look forward to seeing you all next time. Bye.